Hello, good morning to everybody. My name is Eric Casella. I am the coordinator of EU-Africa PerMed. I welcome you all to our last EU-Africa PerMed webinar. We appreciate very much all of you that are joining us. We have prepared a webinar to present one of the last and main deliverables of our project, which is the EU-Africa PerMed action plan. So the webinar, we will have some presentations from the project partners to present the action plan, and then we would like to devote the last part of the webinar to a roundtable discussion moderated by Dr. Mohamed Tahir, in which we will discuss the different opportunities for collaboration, the different actions proposed in the action plan, and how we see the collaboration in personalized medicine between Africa and Europe. I don't know if you have the agenda of this webinar, but in principle there will be a short presentation by Monica Frenzel, which is a member of the EU-Africa PerMed team and also from the French National Research Agency, ANR. She will present to you the action plan. Then we have another presentation from the African perspective from the researcher's point of view that Mohamed Tahir from Tanzania will present. Then our colleague Maria Jose Ruiz from the Ministry of Health of Italy and also member of EU-Africa PerMed will talk about capacity building and networking, and then we will have the roundtable on sustainability and future perspectives. I believe that most of you that have joined today know about EU-Africa PerMed. Very shortly, just in case there is somebody new, our project is a Horizon Europe project funded for 4 years. We started in February and will finish at the end of this month. And the main objective of EU-Africa PerMed has been to strengthen the collaboration between Africa and Europe in the area of personalized medicine. We've been having a lot of activities during these 4 years, and this is really the closing up of the project, presenting, as I mentioned before, the action plan. So I think that I will now give the floor to my colleague Monica, and she will present to you this document. As she will say, it's really it has gathered all and based on all the activities of the project in terms of stakeholder engagement and gap and needs analysis and mapping, we have come up with this action plan, which proposes a set of actions that could be implemented to support the collaboration between both regions. But with no more delay, I give the floor to Monica, and she was a team leader in the preparation of this action plan together with the South African Medical Research Council, and she will be able to give you a short explanation of the context of the action plan. Monica, the floor is yours.
Thanks a lot. And first of all, I hope you can hear me, and I hope you can see the slides just for a short confirmation.
Yes, we can see the slides and we can hear you perfectly well.
Wonderful. Great. So thanks a lot for the kind introduction, Erica, and welcome to everyone already also from my side. It's a great pleasure to be here today and to present in the name of the entire EU-Africa PerMed team. And I would say also in the name of many, many stakeholders that participated in the preparation of the action plan and the general work of EU-Africa PerMed, because I think the action plan is one of the major outcome of this project and is based on so many different discussions with so many different stakeholders over the course of the project. The action plan is around collaboration and personalized medicine. This is what this project is about. EU-Africa PerMed, as Erica said, really wanted to push future collaboration in the field of personalized medicine between Africa and Europe. And Well, before we are starting, it's always good to show what is our definition of personalized medicine we are following. This is why I'm just sharing the few definition, the very short definition, and I would like to underline that it is not essential if we are talking about personalized medicine, precision medicine, or stratified medicine, or whatever term is existing. I think it's important that we all agree that there will be a shift in how we provide healthcare in the future, being more personalized, thanks to more precise diagnostic that allows us more precise treatment strategies, and also the possibility to even prevent diseases if we are able to get an overview about the individuals and their predisposition to disease. Well, as we did not have had a general presentation of the project, we wanted at least to give you an outline how this action plan for collaboration between Africa and Europe in the field of personalized medicine was developed. Our project was acting in two phases. The first one was exploring and analyze the potential and advantages of collaboration in personalized medicine between Africa and Europe. Here we performed in the first year extensive mapping activities to understand the research, but also policy background. Then we started to better analyze and understand the African perspective in terms of gaps and needs analysis, mutual interest in personalized medicine, but also thinking and developing ideas and to propose collaboration models to further push collaboration in the field of personalized medicine. And then the second phase, and based on this first analysis, and that many stakeholders from Africa and Europe were involved, we developed the action plan. And it was in the second phase where we, developed or worked forward for defining and implementing actions for the future. And we are currently now in the phase of course, disseminating, promoting the action plan to support its future implementation. So a bit more in detail, many of the activities and results of EU-Africa PerMed you can find on our website. So for example, the outcome of the mapping activities, please have a look because I think here you can really get an insight of how is specifically in Africa the scientific and policy landscape. Based on this analysis and based on the discussions with the stakeholders, we developed different deliverables that are in part already available on the website. The list of African personalized medicine needs, a list of areas of mutual interest between Europe and Africa. And one, I think, of the most important document that is not yet publicly available is a report on gaps and needs assessment. This last document specifically, the content was developed with stakeholders from Africa, and we validated the different, or we collected the different gaps and needs through our first stakeholder workshop. Here you can get a first outline on, 6 major key actions that we identified that are gaps or resulting from our gaps and needs analysis. It is genetic diversity, infrastructure and resources, access to technology and expertise, data collection and sharing, healthcare infrastructures and awareness, ethical and legal consideration. So this document is very important. It's based on a SWOT analysis. And we are working on publishing the information very soon. What we did, we validated the different outcome of this analysis in the second stakeholder workshop. And based on the discussions we had also on mutual interest and collaboration models, we developed the action plan that was presented and discussed and further refined through the third stakeholder workshop of EU-Africa PerMed. And now I'm coming to a very short presentation of the action plan because we have, it's not a very long document, but there are too many information to pack them in 20 minutes. So please take the time and have a look at the action plan in more detail. But we would like to take the opportunity to present it at least very shortly. So what the action plan aims for, it is with the action plan, we developed recommendations for future collaboration activities in the field of personalized medicine. Of course, specifically to foster collaboration between Africa and Europe. We present concrete activities and actions on the research and on the policy level. And of course, we try already to propose actions that are of interest, of course, for African and for European stakeholders. The recommendations are for collaboration that are responding to common health challenges and needs identified through the diverse discussions with the stakeholders during the course of this project, EU-Africa PerMed. And I think what we hopefully also were able to present is that it is important when we are talking about collaboration between Africa and Europe, that we have to consider country specificities, especially in the African context, because Africa is a continent with many, many different countries, and the status of personalized medicine readiness is different in the different countries. And also we hope to support a little bit the idea of how personalized medicine specifically in the African context could be further supported, for example, on regional collaboration specifically in Africa. We are presenting the action plan and different stakeholders are needed for its implementation to diverse kind of stakeholders, policymakers, national, international, and global funders. The European Commission, the African Union, the WHO, but also to running initiatives like, for example, EDCTP, but also to industry players. And of course, those that are the key players in pushing and driving personalized medicine development from academics and clinics, for example. What is the action plan not presenting? Is a general needs and description of personalized medicine, because there are also many documents that exist and strategic documents that are outlining general needs and description for personalized medicine in general. We really, as a project, based on our discussions, we wanted to present concrete activities and actions in the field of personalized medicine between Africa and Europe. So concrete suggestions, for example, for projects or policy collaboration. The action plan, or for the development of the action plan, we based the content on the gaps and needs we have already presented, and that were identified through the gaps and needs analysis and the SWOP. So genetic diversity, infrastructure and resources, access to technology and expertise, data collection and sharing, healthcare infrastructure and awareness, ethical and legal consideration. We might not follow with the action plan the entire, in the chapters we are not following specifically these gaps and needs, but they can be found within the action plan. We have developed actions in a certain format that are following always the same structure. We describe the activity, of course, have a title. We describe the activity. We explain why there is where is the interest of mutual interest between Africa and Europe for this activity. We describe and try to give a suggestion for the model of collaboration, and also try to give a hint on timing objectives, what are expected outcomes, impacts over the time. We have in total identified and suggest 26 topics. There will be, or there are for sure, more interesting topics. But to have a coherent plan, we have it reduced to 26 distinct topics of research and research supporting actions. Overall, we have two major sections in the action plan. The first one is more general on a personalized medicine adopting environment with three major chapters: infrastructure, education, technology, awareness, ethical and legal consideration, access to technology and expertise. So this section is trying to focus on the entire system supporting personalized medicine adoption. And all different disease conditions, because personalized medicine applies to all different kind of diseases and also includes many different technologies and areas of medical fields, as well as, of course, technologies from diagnostic treatments until prevention. And, oh, I'm so sorry. So now. And there's a second part, where specifically we are describing an aspect that was of importance for Africa. Genetics and personalized medicine. Of course, it is also important for Europe. But what we have discovered when we were discussing with the stakeholders, specifically from Africa, that genetics in personalized medicine is presenting an example for a personalized medicine field that is of specific importance for Africa, because so far we know that Africa is the most genetically diverse continent, with a wide range of ethnic groups and genetic variations. But there is so far a high lack of having the African populations represented in global genetic studies and databases. So therefore, we are presenting genetics here and genomics as a specific, special field that has to be considered, and specifically for African collaborations in the field of personalized medicine. And now, considering that I also would like to take too much time of this introductory talks, I would like to take only two examples to go a little bit more into detail and to present to you, two suggestions that you can find in the action plan. So one is the Action 7 training programs. Training programs are there for knowledge exchange of expertise. So, for example, it could be a training program that focuses on personalized medicine application. So, for example, connecting a clinic in Europe and a clinic in Africa, sharing of knowledge between the different hospitals, and the idea is to bring into a consortium together different actors from both continents, from Africa and Europe, different clinics. It could start with two specific clinics, one, for example, that has already implemented a personalized medicine approach, another one that would like to learn how it could be done. And then it could lead in different stages to different outcomes. In a first stage, it could be simply a knowledge transfer, sharing of expertise and understanding, so could support capacity building. In a second stage, it could even serve to launch larger pilots, in that we start a concrete knowledge exchange and transfer of a personalized medicine approach from one clinic and support the implementation in another clinic. And on the long-term perspective, these kind of activities could support in a long run even the development of a network of clinics and organizations within one continent, or even between two different regions like Africa and Europe. Another example that is more a research example and action is a 10 research collaboration revealing cancer diversity. Of course, as I said before, personalized medicine is disease unspecific, but just to support, to give a starting point, we support or we suggest that there could be, for example, a research collaboration developed around cancer, as it was also indicated as one field of interest between Africa and Europe. And it could be a research collaboration that is pushing and focusing on the detection of new genetic polymorphisms linked to cancer, and considering different cancer characteristics, such as localization of the body or formation of metastasis, but also the influence of infectious diseases, for example, in the development of cancer. Indeed, we have different backgrounds. So here, this is really a topic where the genetics background is really of interest. So here, there is a mutual interest of Africa and Europe, because we are having, of course, our individual populations, and it would be of interest to study this topic with considering our specific populations and their genetic diversity. It should be a transnational project with actors from Africa and Europe, and funding should be provided sustainably through already existing programs. An example could be, for example, EDCTP or other programs that could support this kind of research collaboration. Could be also funding coming from African Union or the European Commission or European Union or global funders. Of course, here's always the idea to develop common principles for collaboration, to share knowledge, to share research results. And in long term, it could develop cohorts that are more comprehensive in terms of data, considering the African and European populations. Yeah, so these were two specific examples. As I said before, there are 26. So the time is a little bit too short to explain all of them. But maybe you had already looked at the action plan. And if you have specific questions, maybe we can also consider them. In general, what we would like to give as key message from the project, specifically when we are thinking about personalized medicine, we need to collaborate cross borders. We need to collaborate between different regions here, considering Africa and Europe, because we need different data sets and consider different genetics backgrounds, different lifestyle of different populations, to have the data sets that are comprehensive and that allow the development of approaches that are broadly applicable for diagnostic therapies, but also prevention. And as we have seen, despite the fact we might have our regional, national, diseases that are the most relevant in our context, we know that also COVID was showing this so nicely. Diseases do not stop at borders. So we really need to collaborate here more precise, more and more consistently and long-term, in a long-term perspective together. And I see a small mistake in my in the citation of the African proverb. So, but what we really see is a project, if you would like to go fast, go alone, but if you would like to go far, go together. So this is really a motto I think we followed in EU-Africa PerMed, and we would like to recommend and hope that this in personalized medicine will be taken also serious in the future collaborations to come. And as final message, I think, from the project is that based on all our discussions with you, I'm sure that in this webinar there are also a lot of colleagues that joined our way in the last 4 years. There's interest to develop personalized medicine in Africa. There is we feel that Africa is ready for collaboration, but we feel for whatever is developed as collaboration between Africa and Europe, also it is important to consider country differences. Also, European stakeholders are interested to collaborate with Africa. And we see from all the different analyses that Europe can sincerely benefit also from the knowledge from African stakeholders and researchers. I said already before, through collaboration with Africa or through African-European collaboration, personalized medicine approaches will be more broadly applicable. And what is really important, African-European collaboration requires sustained funding and different tools for collaborations. Sorry. We are now at the moment that the action plan is handed over to different stakeholders and also, of course, to you to support its future implementation. And therewith, I'm at the end of my presentation. Thank you so much.
Thank you so much, Monica. I don't know if there are any questions or comments. If not, we will have at the end of the presentations, the roundtable discussion. So anybody who would like to comment or raise any question is more than happy to do it. I think there are.
Yes, there are some questions, but I very general. I think we can bring this question to the end after the roundtable, because some of them can be replied during the talks.
Okay, okay, Maria Jose. Okay, then we follow with the rest of the presentations. I would like now to present Dr. Mohamed Zahir. He is a molecular genetics and genetic counselor. I'm reading your bio and it's quite long because you have a lot of experience in many fields, but I would just like to highlight that you are a research coordinator at the university, the Muhimbili University in Tanzania, research scientist at the University of Health and Allied Science, also in Tanzania, but also research associate in the Department of Genetics of the University Medical Center in Groningen. So you have good knowledge of research in both Africa and Europe. And also you have been recently appointed as co-chair of the African Society on Human Genetics. You are, I know, the promoter of the Tanzanian Society of Human Genetics. But moreover, you have been one of our main collaborators in EU-Africa PerMed. From the very beginning, you have participated, I think, in all of our workshops and also in the summer schools. So you know very well EU-Africa PerMed, and now you are really part of the team. So we are really happy that you can participate in this last webinar, giving your thoughts and ideas about strengthening the collaboration between Africa and Europe in personalized medicine with your holistic vision of what personalized medicine is, your knowledge of Africa and also of Europe. So, Mohamed, the floor is yours. And thank you for participating in our webinar.
Thank you so much, Erica. Can you confirm if you can hear me and see my slides?
We can hear you and see your slides perfectly well.
Thank you so much. So good afternoon, everyone. I'm extremely honored to be given this opportunity to talk in this final webinar organized by the EU-Africa PerMed consortium. And of course, the task allocated to me is slightly different from what I'm used to. I'm going to be talking more on the perspective of an African researcher about what I think of the action plan. And I think Monica made my life very easy by explaining how the action plan actually was written down and what are some of the key elements that were considered when jotting down the action plan itself. So we'll be talking personalized medicine in Africa and, of course, my perspectives on how we can further strengthen this collaboration between the EU, Africa. For those who didn't pay attention, my name is Mohamed Zahir. I'm based in Dar es Salaam, Tanzania at Muhimbili University. And of course, I'm very, very happy to be here today giving you this talk. If we really briefly talk about what personalized medicine is, I think we all know it has made a revolutionary change in the way we practice medicine at the moment. Because healthcare nowadays can be tailored in terms of interventions because we take into consideration not only environment and lifestyle factors, but also your genetics. And so you can imagine that we are able to have much more accurate diagnosis. And then subsequently, because of that, we are able to provide you with much more tailored therapies. However, I must admit that personalized medicine so far for the continent of Africa has not really done justice in the way it has done for other parts of the world, particularly in the high-end countries. And that comes down to the fact that the African population is extremely diverse in its genetic makeup. And we've seen, of course, in studies in the past that talk about two important findings. One, that the African population not only has a lot more number of genetic variation in their genetic makeup compared to other populations, but also there is a very significant difference between different populations that come from different parts of Africa. And this means that there is a lot more research that's required to understand the genetic diversity that's present in the continent. And then subsequently, how do we then ensure that that information is processed in a way that yields benefits when it comes to providing tailored treatment opportunities? Unfortunately, this has not been the case. If we look at the amount of data that's representative of African populations. This was taken from a presentation by Professor Segun Fatumo, where he showed that if we look at the global genetic data sets of individuals in the genome-wide dissociation studies, and just 2 years ago, in 2022, about 1.1% of that data was actually representing the African population. And if my memory stands corrected, this number has further gone down to 0.8% as of this year. So in fact, the problem is getting worse and worse as far as representation of African genetic information is concerned in these genetic data sets. But why is Africa so important? And I think this is critical for us to understand. Africa is the second most populous continent with about 1.4 billion people. And in 54 countries, we can't paint each country in the same with the same brush, because we've got more than 3,000 ethnic groups and over 2,100 languages that are spoken in the continent. And if we fast forward sort of, from a statistical point of view, at the moment, 50% of the African population are children, meaning that they are less than 18 years old, and therefore that by 2050, 40% of the world's children will actually be living in Africa. And this should be enough reason for us to really pay attention to Africa and try and find mechanisms in place, especially to promote genomics through personalized medicine. Now, my task today here is to provide you, of course, my perspective as an African researcher, what I think about the action plan that has been developed by the EU-Africa PerMed. And in this particular context, I think it is important to mention why Africa is key. Now, of course, if we rewind back to about 400,000 years ago, it's critically important to understand that at some point, all of us were Africans, or all human civilization, Homo sapiens, were actually African. That's why Africa is called the cradle of mankind. But given that there is a difference in the diversity of different populations in Africa, it is an important key player to understand the genomics, to really implement global genomic research, because there is a lot of information that can be extrapolated from African populations that would benefit not only the continent, but also benefit the rest of the world. And so it is important for us to understand and make it clear that if we really want to use genomics in the best possible way, particularly in the field of personalized and precision medicine, you have to involve African populations to really be able to do this. And of course, it is critically important for also us to understand the Africa's unique health challenges. We've got a huge problem of sickle cell disease in the continent, huge problem of infectious diseases, and of course also non-communicable diseases. So this is a critical position whereby we are really at crossroads between trying to understand how we can implement genetics and genomics to fill that gap in the personalized medicine, and as far as finding right diagnostic and tailored treatment approaches for these diseases that we are really fighting on a daily basis. So as I said, my task here is to assess the action plan and highlight the potential impact that it has on the bilateral relations between the two continents, and how that might be relevant to our way forward. Now, of course, Africa and Europe it's not like they are not working. There is already a huge association that's going on between the different countries. And as you can see, this picture was taken from the action plan itself that shows how European countries and African countries continue to collaborate through different co-authorships between these two countries. So it's clear that there is a lot of work going on in the field of medicine, in the field of genetics, in the field of precision medicine, where African countries and European countries are working together. And so what technically we really need to do is to build on this important relationship. If we look at the context of the action plan, as Monica really explained very nicely, that the key objective of the action plan is to find a way to facilitate collaboration, particularly in the field of precision medicine, for research between Africa and Europe. And of course, use that to improve bilateral science, technology, and innovation relationships between the two continents. And why I think this particular context is so important is because it addresses not only the important component of infrastructure development, and we'll see that shortly, but it also talks about capacity building as well as ethical and regulatory frameworks. Now, of course, we will delve into these components much more when we are going to have our roundtable discussion. But I think it is critically important that this is something that, why should it matter to Africa, is that it provides us with the important tools to address what are our local healthcare challenges. And of course, it also aims to build the capacity and how do we integrate this precision medicine into our healthcare systems. I think most of us that are living in Africa, working in Africa, doing research in Africa will testify that once a project is initiated, by the time the funding is over, the research also dies. And most of the time, that research does not really end up into the healthcare system as it should. But I think opportunities like these, where we have a beautiful collaboration between the European continent and the African continent, will really try and integrate what we are trying to achieve through these initiatives to really be part of the healthcare system. And I think going back to the core features, it is important, if we really want to make that part of the healthcare system, we really need to look at infrastructure, we need to look at capacity building, and we need to look at the regulations. So these are, in fact, indeed also the strengths of the action plan, because when we talk of infrastructure development, at the moment, of course, different countries have different levels of infrastructure development done. But in general, I think it is critically important that if you want to address diseases, and of course, this is the point where we say that Africans should understand and be able to say what are the pressing diseases in their continent which needs such collaboration, and how do we make sure that there is mutual benefit in these kinds of collaborations. So biobanks and genomic hubs is one way to develop infrastructure gaps, but also at the same time, development of these bioinformatic networks where we are able to locally analyze our own data is also critical for sustainability, but also for innovation to take place in Africa by African people. And that brings me to the second strength of the action plan, where we're literally talking about how do we ensure this collaboration towards capacity building. And we can think about medium, short-term, and long-term exchange programs to create the required skilled professionals in our field that would then be easily employed through our healthcare systems. And here we can think about clinical scientists, clinical geneticists, we can think about bioinformaticians, we can think about genetic counselors, we can think about ethical, legal, social scientists, and many other parts of the health and allied healthcare system that would benefit from such capacity building through knowledge sharing. And the other thing that is also critically important, and I have to, it would not be fair if I didn't say this. African continent and African countries in the past have been victim to helicopter science. This is a fact. Many different groups have tried to utilize samples coming from Africa, whereby not enough African authors are mentioned in the paper. The samples are taken away from the continent, and in return, there is no capacity building, there is no training, there is no benefit going directly to Africa. And I think this is why this third strength is really important, where we have emphasized on fair principles. We've emphasized on the importance of data sharing in an ethical way, as well as making sure that there are frameworks that are regulating how data sharing and accessibility is done. This is critically important because as we go forward, there needs to be mutual benefit, there needs to be trust, and there needs to be science done in a way that is fair and ethical in all sorts of definitions. But also what is very important as far as the action plan is concerned is that it takes into account the inclusivity plan, meaning that it is important and it acknowledges the fact that Africans need to be represented in these global genetic researches. And so you can think about perhaps future grant applications, whereby you probably want to make sure that there is an African group or an African cohort that's involved in the study of a particular disease that would be part of a grant application. And so that is critically important, I think, for Africa, and the action plan provides that aspect. But of course, to make sure, to be fair, there's also a lot of challenges from an African perspective as far as how much we can really implement. And of course, we do understand there is still quite a number of infrastructure gaps because there is limited access to these research technologies and facilities. Not every country in Africa has the state-of-the-art genetics lab or state-of-the-art equipment that would be needed for personalized medicine. We still have a lot of reliance on external sources. One of the other huge problem that we still have is sustainability. Like I said, when a research project takes on, by the time the project is over, it does not necessarily get into the healthcare system because there is no money that would then look at how do we make sure that the project actually ends up becoming part of the system. So long-term funding and government buy-in is still something that is of concern, and we need to find ways to make this possible. But then there's also, equity in collaboration. Like I said, we've always been at the risk of unequal partnerships. We've been at the risk of helicopter science. And so I think it is important that once these action plans are put in place through the right kind of channels and regulations, then such science will not take place. And lastly, also challenges as far as policies are concerned. So we really lack some of the precision medicine policies into our national healthcare systems. And like I said, while these are the challenges that probably will slow us down in the process, I actually see them as opportunities. And so the way I see this is that it is an opportunity to increase Africans in global genomic discoveries as far as African genetic diversity is concerned through such collaborations. There's also an opportunity for us to be part of knowledge transfer. And when I talk of knowledge transfer, this is not a one-way street. While European expertise is very much welcome in the world of precision medicine towards Africans, at the same time, African scientists and researchers also have a lot of information to teach European counterparts. So never think that this is a one-way direction, but rather this is a multi-directional approach whereby Europeans are also learning about different diseases in Africa, and Africans are also learning about different skill sets that is required from Europeans. And that is something that is a very important opportunity. And of course, one of the other things that we will really have opportunity for mutual benefit is in the health equity. I think collaborations like these and projects at this scale can really reduce the health disparities that we're seeing around the world and hopefully improve outcomes. Now, I know this will take some time, and we are not naive to say that we're going to change the world in the next couple of years. But I think it is important to put down the seeds of right practices and put down some of the documents that will be our guiding light on how we need to go forward before we really see the benefits in our healthcare system. And so if we look at some of the actionable steps as far as implementation of these plans are concerned, what we really need is to promote Africans to lead these initiatives. And so therefore, it is important to encourage African leadership in research and decision-making, something that historically has not been the case in many sort of partnerships. But I think this particular partnership is very, very suited to ensure that Africans are leading. It's also, leading toward tailored precision medicine strategies where we have solutions or we find solutions that are in the context of the African culture or in the context of the socio-economic culture of Africa. It is not possible to do what people do in the United States as the way it is done in the United States in Africa. I think it is important to take the African socio-economic status and culture context and therefore to tailor that into a strategy that would work in our continent. But also what is really important is we need to think about how do we secure long-term funding, whereby we need both local and international funding sources to combine and come together to find mechanisms towards sustainable funding long-term programs, such that they are not only ending at the research project, but they will end up in the healthcare system as actual plan, which is implemented. And of course, we cannot do this thing without training programs. And so we need scientists, healthcare workers, and policymakers to come together and exchange resources, exchange knowledge. And like I said, this can be through either training short courses or medium term or long term, or even exchange programs between countries or universities in these two different continents. And lastly, I think we should not forget on what we already have in the continent. And I think, initiatives like S3 Africa, and now we have the DSI Africa, are initiatives that we really need to build on. So we need to leverage these existing networks and see how best we can incorporate them into these new partnerships. So I'm going to put down some of the visions that I think I want to have for my continent, for my country in the future. One of the first thing is that my vision for the Africa-Europe collaboration in personalized medicine is one of equality, sustainability, and shared success. Is something that I think we are going to be on equal footing with mutual respect and mutual partnership. And of course, going forward in 10 years, I really hope to see that African-led genomic research centers are contributing towards groundbreaking discoveries to the global community. I really hope or envision that healthcare systems where personalized medicine is integrated is going to help reduce some of these disparities and improve the outcome for millions of people. And lastly, I think by achieving this vision, we really need commitment from all stakeholders. So if we prioritize equity, sustainability, inclusivity, we can ensure that this collaboration is transformative for both continents. And of course, for my African colleagues who are listening to this presentation, I would say Africa's people really must be able to write their own genomics agenda. And of course, genomics agenda is not different from precision medicine agenda. So we are in the right position with partners like Europeans who are looking at us from a mutually respectable angle to take the opportunity and be sure that we are also part of writing our own genomics agenda. And I want to end my presentation with a slide from Professor Segun Fatumo's paper, where if we really want to talk about roadmap for sustainable diverse genomic studies, what we really need is to engage our community, our researchers, our funders, and look at how much of they are willing to be part of the movement. We also need to look at our infrastructure by trying to improve our biorepositories, biobanks, and computing infrastructure. We need to think about, of course, strategic funding as well as build capacity. And such collaborations like the European and African Union, we need this global consortium to really make a difference. So with that, I really want to congratulate Monica, Erica, and the team. I think you guys are doing a fantastic job as far as this driving the EU-Africa PerMed is concerned. I'm very optimistic about the future, and I think there is a lot of work to be done. I think we've reached a point where we now really need to start to put the action plan into action and implement that. So I'm excited, and I must thank you for all the work that you're doing. So thank you very much, and looking forward to our roundtable discussion later on.
Thank you very much, Mohamed. Your presentations are always very, very nice because you bring up many relevant ideas. I like the way you show the value of the collaboration in terms of two ways. I think one thing we have learned in this EU-Africa PerMed project is that Europeans can also learn a lot from Africans. So it's really a two-way collaboration. It's not only for us providing the funding for you to carry out the research, but I think we have to assume, and this is something I think that all of us in EU-Africa PerMed have tried to translate whenever we have the opportunity to speak to the European policymakers and funders of the value and opportunity that it is to really to collaborate with Africa, and also to build on existing initiatives. This is something we also had in mind from the very beginning in EU-Africa PerMed, because we are a 4-year project that finishes and we need really to sustain our work further on in what already exists. So we are in this way very happy to share the action plan as a tool that can be taken up by anybody who is able to support the implementation, whether it is at the level of funders and policymakers, but also as researchers. I was thinking that maybe sometimes, and I think you mentioned, Mohamed, when you are preparing a proposal for a funding opportunity, a good way of supporting what you are proposing is to show that there are some documents and some plans that already give the evidence that this is value. So I really encourage anybody to use our action plan if it helps them to support any topics, if they are talking to funding agencies or if they are preparing collaborations, because it really is the way that we can sustain the work and see if any of the actions are afterwards implemented. So thank you very much. Now we have the opportunity to hear our colleague Maria Jose Ruiz. She is also a member of the EU-Africa PerMed project. She works in Italy. She is the research coordination and promotion service at the Italian National Institute of Health, but she also works at the Ministry of Health of Italy. And she will talk to you about, let me check the agenda, networks,
Capacity building
networks, capacity building and networking value, because she has been co-leading the Work Package 5, which is focused on capacity building and training, and it has really been an excellent tool to create networks between African and European researchers through this type of webinars, and also the other training activities such as the summer schools that we have carried out in the project. So Maria Jose, whenever you want.
Thank you. Can you hear me well? Perfect. Thank you. Then good afternoon, everyone. I think most of the main points about capacity building and bidirectionality has already been discussed, but I will try to share with you the importance of the capacity building and the significant value of the networking in achieving our goals in this consortia. It's clear that an increasingly interconnected world, the ability to build personal medicine capacity within teams and organizations and to create meaningful networks, I think has never been more important. But what is capacity building and what is really important? Capacity building refers to development of skills, knowledge, tools, and resources needed to enhance individual and organization personal medicine research ability. And why is important, as we have already seen, it allows organizations and individuals to increase the ability to address challenge, innovation, and to achieve sustainable success in the field of personal medicine. But if you think about capacity building, it is a multifaceted concept connected to several crucial areas. And these areas are, among others, can be organizational and institutional context, community or regional context, also collaborative partnership context, global and policy-oriented context, and of course, human resource development, such as training, education, and mentoring, to nominate some of the priorities. And after our first recognition of the ongoing or done activities on capacity building in Africa, in our consortium, our key activities for the advancing of personal medicine has targeted researchers, healthcare workers, and in the second phase, also patients. After a first step of mapping the need, the gaps, and the current and building initiatives, we see that the most important points were the education and training. And these educational trends are related to to highlight the importance of the knowledge transfer, the professional development, and the network building to stimulate innovation and foster collaboration. I would like also to emphasize the direct connection to healthcare clinical practice, focusing on workforce development and in patient-centric care, ensuring that the personal medicine is tailored to meet the local health care needs. Additionally, it touches also the policy concepts, which indirectly support personal medicine through the reinforcement of the policies that create an environment for its implementation. And finally, we have addressed the need of the strategic research infrastructure, ensuring equitable access, achieving through effective resources mobilization and sustainable funding. And now what is networking? Networking is the process of establish an engagement professional relationship that foster growth for both individual and, of course, organization. It adds significant value in several ways. Firstly, it enhances the collaboration by sharing best practice and lesson learned. It also promotes knowledge exchange, enabling mutual learning about disease-specific personal medicine application and facilitate the transfer of successful strategies or personal medicine research models. The networking also supports sustainability and growth by strengthening the capacity to sustain the institution efforts and encouraging resource pooling for joint personal medicine initiatives. It builds cultural and contextual sensitivity, helping individuals understand diverse healthcare systems and cultural beliefs, and which is in turn support the development of context-specific personal medicine solution. And the long-term impact of networking is also essential. It helps build a robust interconnected network and drive systemic changes by amplifying the research and also the patient voice in personal medicine policy and practice. We can say that the networking is so important because it can lead the innovation through the sharing of the ideas and experience. And how the capacity building and the network working complement each other. In this chart flow, you see our idea of capacity building in our consortium. The chart starts for the training to the networking, leading to the influence of policymaker. The flow begins with the training education, which serves as foundation for building a skill, we can say a skill workforce, capable to understand and implement personal medicine in various settings and in both regions, Europe and Africa. Through targeted training programs, professionals acquire knowledge to apply personal medicine research specifically. And next, the networking phase comes into play. As trained professionals collaborate across regions and disciplines, they can build strong networks that foster knowledge exchange, innovation, and regional collaboration, but not only among Europe and Africa, but also among the different regions in Africa. This networking helps integrate diverse perspectives, leading to more effective solutions, greater synergies in research, and finally, the networking effort and accumulated knowledge serves as a powerful tool to influence policymakers. By demonstrating the collective experience, the evidence, and the success stories, professionals can advocate for policies and strategies that support the broader adoption of personal medicine. In our activities, we develop or set up 11 webinars, including these, and 2 face-to-face training events with different impact in the networking. In this slide, I can share with you an example of the result for our face-to-face event complemented with activities online. We have observed excellent participation, both geographically from Europe and African countries, but also, and following the different topics, we have also UK and sometimes USA participants, and very different related disciplines. And the gender balance was also well represented, and overall, we received a very positive feedback with participants expressing confidence in applying in the future the knowledge gained to the respective field of the research. And the experience acquired has contributed and will contribute to enhance clinical practice, improving research design, fostering collaboration on clinical research goals, and inspiring other education initiatives. And we are thinking, and we hope to include or to follow this online and face-to-face initiative in the European Partnership on Personal Medicine. For this reason, in the action plan, you can see the needs of training and network initiatives across the various topics and recommendations outlined in it. I think that is already discussed, and just to highlight the example of one of the key areas, that is the patient-centered advocacy at training in personal medicine. We have discussed this in our second step of the webinars, and in this action plan, you can find that the efforts are focused on enhancing the skill and knowledge required to effective advocacy and for support patients within the context of personal medicine. Just to highlight with you the importance of the timing of the objectives. You can be both in both areas of mutual European and African interest, the short-term objectives is to organize training actions for and by patients, establish link with the Africa and European Patient Association, and of course to empower the association driving the knowledge sharing and personal medicine awareness among patients, but also among families and the general public. And this is all for my side. Thank you very much. And I just to say you that you can find all our webinars and the recorder of our face-to-face events in the website. Thank you very much.
Thank you, Maria Jose. Thank you very much. I think maybe now, well, we have the roundtable discussion, but I was thinking that maybe we can try to respond to some of the questions that the audience is asking, because I always feel that sometimes we miss the opportunity of responding. What do you think? We can start maybe with some of the questions. Now the roundtable discussion will be moderated by Mohamed, and we have the participation of Maria Jose, Monica, and our colleague Teresia Neawira, who has not spoken, so maybe I will introduce her. She's also a member of the EU-Africa PerMed consortium. She works at the National Commission for Science, Technology and Innovation in Kenya. She can also bring a lot of knowledge from the African perspective and her ideas and thoughts about the collaboration. But maybe Mohamed, what do you think? We can maybe try to. I had a look at the questions. Some of them require maybe a full webinar to respond because they are very long. But maybe we can try to respond to these questions, and maybe that can even bring us to the points of discussion that you already had in mind. So we can maybe start like this.
Thanks, Erica. I think it is important to start some of these questions, which I think are very important, and I'm glad that you mentioned that we take those first. I want to start with Alice Veronica Lamwaka, and I believe there are a lot of questions from Lamwaka Alice Veronica, who is a PhD from Gulu University in Uganda. And I'm not going to read all these questions, but I think what I will ask each of you to comment on will be based on the themes of some of these questions. So if we look at the research and development questions, they ask what specific personalized medicine approaches will be the focus of this collaboration. and how are we going to address the gaps in the personalized medicine research between European Union and African countries. I think Erica, perhaps you could take that. I'll give capacity building and training to Monica in terms of what capacity building initiatives will be implemented to enhance those skills, how this collaboration will ensure there is technology transfer, and what kind of training programs will be put in place. Maybe we can start with those two and then see if you want to take more.
Okay, I will try to respond. As Monica commented when she presented the action plan, really the work, I mean, the actions we have defined, which there could be more, of course, but the ones we have tried to define in the action plan really come from the analysis of the gaps and needs of implementing personalized medicine, and also focus on areas where the collaboration between Africa and Europe are of mutual interest for both parts. So really any of the actions that are presented in the action plan do address the existing gaps. Of course, there are some gaps that are maybe more specific for Africa, because as Monica also commented, Africa is a big continent with 54 countries, and the countries are in very different situations. In Europe is also the same, but we are much smaller, and we have also the umbrella of the European Commission, and the collaboration is already more established. But I think for African countries, there are still some needs that need to be filled before some of these African countries can start collaborating with Europe, because they have to create the capacity within their own countries. So there are also some actions in the action plan focused on specifically on African countries in terms of addressing the existing gaps in these countries to advance in personalized medicine.
Thank you so much, Erica. Monica, would you like to comment on the capacity and training aspect?
Yeah, of course, my expert in capacity and training is Maria Jose. So please you comment and complete wherever you feel. I think if I go to the action plan, I would like just to clarify that we are highlighting needs, different needs to push forward personalized medicine. Well, to have the environment available to create the environment to endorse personalized medicine in different countries. It is not that these are the actions that we will implement in the next. So it was just the way the question was asked. I would like to be just sure we are here highlighting what is needed, and we need now to push forward that this is put into place. It's not us that specifically will implement these topics. But I think in the action plan, if we just go into general, what we identified for personalized medicine specifically are capacity building needs in different areas. So for example, bioinformatics. I have the feeling, and during the discussions, by the way, I don't know if this is this helps for the African context, but even in Europe, we still lack the number of people or experts in bioinformatics, for example. I think this is with the new field coming of personalized medicine, where data are more and more available in electronic format, and we need different people to combine different kind of data sets. The need specifically for bioinformatics is there. Complex data sets are generated now also with new diagnostic tools. And sometimes our physicians and medical doctors are not having the time anymore and not the knowledge to go therefore into detail. So there's a specific need for capacity building in this area. Then simply, I think there was a twinning program where capacity building is part. So many actions, it's not on the header, capacity building, but when the actions are put in place, they are supporting capacity building, sharing of knowledge. For example, the twinning calls is sharing of knowledge for clinical approaches, clinical application. There's also one aspect I wanted to mention that is really important is ethical consideration. It starts with training programs, ethical committees. It's not only the creation of ethical committees. I have the feeling there's still a lack in many countries of having ethical committees in place, but even if there are, to train them for what are specifically what has to be specifically considered when we are coming to personalized medicine. I think, Mohammed, if I'm looking at your points, genetic counseling and everything that is behind here. So having already the genomics, genetics perspective somehow considered is for many countries still a challenge. So I feel this is why my answer is not short, but I think there are many parts where capacity building is needed. And I hope this is a low-hanging fruit, because there's also so many education and training videos, for example, virtual tools even available. What we would like to push also as a program, that they are simply translated in many different languages, because we does not need to invent something new, but we can better share what is already existing. But well, I of course, if Maria Jose, you have something to add, you are my specific expert in capacity building. So Mohammed, if you allow to.
Yes, absolutely. I think Maria, you have all the rights to also chip in about the capacity building and training programs, please.
Well, I think Monica has already said all, but just to highlight the importance of the also the to-face events. I know that this always depends of the economic and human resources, but in the training events in person, we not only share knowledge, also we share also expertise, gaps, challenges, problems that usually nobody explain when are doing a lesson or a talk. And then this is one of the most important point to understand how is the research going. Because also to share the problems, not only the successful researchers are important. And this is one of the important points of the networking activities. Thank you.
Thank you so much, Maria. I think I want to second what Monica also has just mentioned. I think this is an opportunity where we are laying down sort of the foundation on how the collaboration is going to look like. But what is really important here is that we African researchers based in our universities, in our healthcare setting, should be able to say what we need, should be able to say how do we want to engage in what kind of topics, in what kind of training programs. I think we need to come up with ideas, plans, and disease mechanisms that we want to understand, so that we put down the basics in terms of how the collaboration would look like. But I think it is up to us now to really make use of it. I think, Monica, that's what Monica was trying to say, that it's not about the Europeans now telling us that, oh, we need to do this, we need to do. No, it's about Africans making sure that we are defining our own genetics agenda, and that we should be able to be in a position to say that this is what we would like to learn, or this is what we would like to participate in, and do those kind of things. I want to move on to some of the more important questions, and I want to invite, of course, together with we have Monica already here, we have Maria, we have Erika, but I also want to invite Teresia to the panel as well. Most welcome, Teresia. I hope you are there. And if you don't mind, yes, thank you so much. I think if I can quickly come to the point, what are, according to you, are the most critical research topics within the field of personalized medicine that we should jointly address together with our partners from Europe?
Thank you very much, Dr. Mohammed, and thank you for having me in this webinar. I would want to take that question based on some responses. We did, Monica actually said that the action plan has been developed out of actions that have been taken by the project. And one of those actions was a survey where that same question was asked. And I want to respond based on the stakeholders' responses. And one of the very important research area that came out so strongly is cancer. understanding cancer etiology, epidemiology, refining the immunotherapy strategies that are there. Also understanding gene, polymorphisms and also predictive biomarkers. The other area that came out so strongly that would be a priority is infectious diseases, particularly the big ones. And this has also been highlighted in the action plan: the malaria, the TB, the HIV/AIDS. And on this, we have issues of drug resistance and also interactions because of issues of co-infections. We have something that is also coming out so strongly, and I say this because I come from a regulatory space where I'm able to see quite a number of research activities that are happening. The alternative therapies, particularly the phage therapy in this area. Of course, there is the surveillance and prevention. The issue of emerging and remerging infectious diseases also comes out strongly in this, particularly the zoonotic diseases, and definitely the vaccine development and delivery. Now, apart from the cancers and infectious diseases, we also had issues of the metabolic diseases, the cardiovasculars, and the rare diseases. But I think, allow me, Mohammed, to also mention that apart from these thematic areas, there is need to understand the PM adoption and implementation support environment. The policies that are available, the ethical, legal, social implications and frameworks that would support implementation of these priority areas. I think that's what I can say in regard to that. Thank you.
Thank you so much, Elsie. I think you're spot on in terms of mentioning these critical areas where we really need much more data to be generated so that we are in a position to also think about, local therapy. I want to quickly invite again Monica to this to the question. According to what we've discussed, how could these priorities, be aligned with funding opportunities and capacity building initiatives? Any thoughts on that?
Yeah, I think it was mentioned during the different presentations that, of course, during the running time of EU-Africa PerMed, we also checked, and you said it, take advantage of existing initiatives, because, of course, while the action plan can be adopted by any initiative existing, and also Erica said it, keep in mind, even if there's a call not 100% focusing on personalized medicine, but personalized medicine as a project could be fitting to the call. Don't hesitate to take one of the topics to frame your programs. But especially when we were developing the action plan, we tried to do this for individual actions where possible. We hinted to existing funding programs, opportunities, for two reasons. Well, first of all, to promote them also. For example, EDCTP is a very impressive initiative existing in the 3rd edition, where many countries from Africa are participating in. There are, for example, regional networks that are supported. So this is something that we noticed in the course of our program. And I think it was mentioned already also in the discussions. Maria Jose, I think you mentioned it, how the value is supporting neighboring countries, creating networks. So maybe the networks from the EDCTP could be also a good support to, further support neighboring countries to create networks or different initiatives. There are European initiatives running, the European Partnership for Personalized Medicine, where I'm first of all focusing maybe on funding programs, right? And we have presented the action plan, for example, to the European Partnership for Personalized Medicine, where also we hope to welcome African funders to join to make co-creation in terms of funding opportunities. And then, of course, I think there are different calls that are launched in different topics, also from global funders. And what we did to push that there will be funding opportunities coming is to present in the little time this project has still the action plan to different funders to, hopefully further create funding opportunities and to reach out to already initiatives that are pushing capacity building initiatives. And of course, I named very few, and there are many more existing. So also, if you are part or you know any initiative that could further promote or could consider parts of the action plan. I think it's really also what we try to search with this webinar, to say, as Erica said it so nicely, this is a document for you to use. It is a strategic document. And I can just underline, well, despite the fact that we propose some, please take the liberty to take the action plan to share and, well, with potential initiatives to implement it.
Yeah, I totally agree, and it's absolutely important to make sure that we're sharing this action plan widely, so that much more, funding agencies are also listening to how we can do this in the right way. Now, I want to bring in quickly, Erica. I want to bring you back to this. We've been talking about, the importance of integrating precision medicine into the healthcare system. We say that it is important that research does not only remain at research, but it should be part of routine diagnostics. How do you think this cross-regional collaboration inform or even support the policy changes that are needed in our healthcare systems to integrate, precision medicine in Africa, but also in Europe? If you can unmute.
It's a very, very relevant question, I think, because sometimes when we are trying to support the collaboration, we tend to focus only on the research level. And it's really, really important also the collaboration at the policy level. Because as you say, at the end, what we are all aiming at is that personalized medicine is actually implemented in the healthcare system, because that's where the population and the patients will really benefit from the opportunities that personalized medicine brings. So I think in this regard, in EU-Africa PerMed, we have considered that the collaboration at the policy level is very important. And I think because they are the ones that at the end will need to create the infrastructure and the knowledge to support this. And in this regard, and Monica can also talk about this, is the example of IC PerMed, which is really a platform of policymakers and funders, ministries of health, ministries of research, sharing knowledge and sharing best practices and sharing problems and sharing not only how to set up the research agenda, but also how to implement policy making. And in this regard, I think some of our actions are really focused on the networking between policymakers across different countries. And I think that is very relevant also for Africa, to share problems and to share infrastructure and to share knowledge on how at the end you're going to implement the personalized medicine in the healthcare system. So there should be also, I think this cross-border collaboration at this level is really, really important for personalized medicine.
Thank you. Absolutely critical. I want to go on quickly with other questions as well. Maria, if I can quickly bring you in. We've been talking about collaboration between Africa and Europe. According to your experience, what is really critical? What is the key ingredient to make sure that this collaboration that will involve African and European institutions is successful?
Well, as you has already highlighted in your talk, I think there is the three core areas, the three quick question that are the equity, the communication, and the sustainability. I think equitable partners are crucial. It's not just about sharing resources, but also about recognizing and valuing the strengths of each partner brings. And for example, Africa institutions often have deep insights into local disease partners and community engagement, while European institutions can bring other advanced technologies and infrastructures. And secondly, a clear and open communication is also vital, because we know the language, the culture, or even the time zones, no, can be a barrier. And so having dedicated coordinators or consistent touch points ensures everyone is aligned. And finally, the sustainability. The sustainability is essential. When we focus on training local researchers, developing infrastructures, and co-create solutions, we need a long-term impact that continues well after the consortium concludes, as this is the case here. And
Thank you so much. In this next segment, we've been talking about funding sustainability, and I want to dive into this a bit more deeper. If I can start with you, Erika, I think, given with your experience, what do you think should be, innovative funding models that would ensure perhaps a long-term sustainability of such a collaboration between Africa and Europe in personalized medicine? And in the same context, I also want to ask Teresia, from an African perspective, how can we really encourage and engage our governments, and institutions to also prioritize investment in genomics research and infrastructure? So maybe Erika, you can start, and then Teresia can continue.
Yes, sure. Yes, thank you very much, Mohamed, for the question. I want to take advantage of some of the work we have done in EU-Africa PerMed in this last part of the project, which was preparing a second policy brief that will be, I think, available very, very soon, because we have tried to identify ways of sustaining the collaboration and what are the best models and tools to do this. And I think one of the things we have highlighted is the fact that maybe research projects will benefit from longer funding duration. So instead of giving money 2-3 years, extend it to 5, because it does take time to set up these type of collaborations, and sometimes 3 years are not enough. Then something that has come up also in many of our stakeholder workshops is the need to have some funding, not only to research, but also to bringing the implementation research. I think this is something that I have heard in many fora, and it happens also in Europe. There is a lot of research for early stage discoveries, but when it comes to implementation research and to, okay, let's check how these really can be implemented at the health system, there is no funding available at all. So this could be also new ways to approach the collaboration and share the experiences from teams in Europe, and maybe how these can be implemented at the African level. You need to do implementation research. You cannot translate for sure the tools from one region to another without doing this. Infrastructure, sustainable investment in infrastructure. And in terms of funding models, I think Monica mentioned as one of the actions, because I think it's really something that is not normally used, is the twinning models. I really like this type of collaboration when it comes to especially European African collaboration, and how the sharing of knowledge and experiences from organizations that are more developed and how they can be translated in other parts of Africa. Sometimes these type of projects do not need a lot of funding. Normally we are used to having projects in Europe of 20-30 million euros, working on basic research. And sometimes these type of projects, as well as the networking or even the projects such as EU-Africa PerMed, they are small in terms of funding requirement, but the capacity to have an impact are huge, because they create networks. And this knowledge translation is something that I feel should be promoted in both parts. And I think it's an excellent tool to support the collaboration between Europe and Africa in any area, but specifically in personalized medicine, because it does have also in mind issues related to capacity building and training, exchange of researchers from Europe to Africa or Africa to Europe, mentorship. So you could have many activities ongoing in this type of models.
Thank you so much, Erica. Teresia, any thoughts from your side on how do we encourage African governments to prioritize investments in this area? I know this is a tough one.
Not really. I would think that, for governments, they want to understand, the language of governments would be, for example, being able to demonstrate what are the public health gains and our ability to, unpack the benefits of PM to a level that governments would be able to understand. Creating awareness, emphasizing with very clear examples what genomic research can do to public health. And I like always, when I get myself in these forums, to use examples like, the case of HIV. The case of HIV and how the first line of treatment was not working for at least 30% of African HIV patients, and how, genomic studies were able to reveal that drug metabolism was the issue, sorting out a problem that we had in terms of HIV patients. And that's the language that a government, a policy maker should be able to understand, interpret the benefits of PM from the perspective that requires their support. I would also think the issue of showcasing the potential of PM to spur innovations, particularly health products, diagnostics, the technologies that PM is able to stimulate development of innovative products, that fosters economic growth. That is the language they want to hear, the economic growth, job creation, and truly PM is able to really speak to the needs of a country from the perspective of a government, also showing economic potential of PM by demonstrating that PM tools are more effective, reducing healthcare costs, improving health outcomes. These are my thoughts in terms of encouraging African governments, particularly the communication of by scientists when they are engaging the African governments and regional institutions, so that they're able to prioritize investment in PM.
So on the same note, Teresia, if I can continue with, there is of course this important thing to realize that, in our countries, we don't have too many resources. And of course, we need to be smart in terms of how do we really balance the cutting edge technologies that exist with the resource constraint in our countries. How do we really find that balance? And on that also, I want to bring in Monica. Could you tell us perhaps, when you talk of establishing biobanking or genomic hubs in Africa, how can European institutions support these kinds of efforts? So Teresia can go first, and then Monica can continue.
Yeah. So
okay.
Maybe
Monica, you want to start? Fine. Thank you.
Yeah, I can make a first attempt. I think important are two aspects here to consider. In fact, we can follow immediately on what Teresa said: awareness raising, specifically for the policymakers, for the needs and the advantages of these kind of infrastructures. It could be biobanking, it could be on a data repository. So there are different type of infrastructures that can support research in general. I think this is important. It's not only on personalized medicine, it is supporting personalized medicine, but it is supporting also research in general, and it is supporting even healthcare in a long-term perspective, because it could support the establishment of common principles. So raise awareness for the policymakers, because I think those are the ones providing funding. So specifically for this, I think it's important. Then the second part is that is more pushing to what I just started to say. It helps even the healthcare system. What infrastructures as benefit are bringing is alignment of methods and methodology processes. This is allowing cross-border collaboration. But I think I think there needs to be the establishment on two different levels. For example, if what happens in Europe, so what we can learn from Europe, the European Union understood it could be of advantage to organize this centrally for different countries. What they did, they are supporting funding of a common pot from the different member states for a kind of a central hub. I don't want to say coordination. Let's say central hub that develops documents for alignment, strategies, and then can support afterwards national hubs that are implemented. The national hubs are then acting really on the national level, but they get a lot of support from the central organization that is supported centrally, for example, in Europe from the European Union. I think why it is important, so this is what you can learn from Europe, especially how also to work cross-border, how to make cross-border collaboration, because common principles create trust, common principles create also harmonization of data, sample quality, what gives us the possibility and the researchers also to combine different data sets. So instead of re-chewing everything every time, you can use already existing data sets because they're developed with the required or requested methodology and quality. And maybe the last point I wanted to say is the importance of national funding, nevertheless. I think specifically for Africa, a good example could be create on the national level first, for example, a genomic databases, create national genomics program. They could be small at the beginning, but it provides a baseline for cross-border collaboration because you can come immediately with your first data sets instead of having others coming to take samples, to develop them, analyze them externally, and keep the data. So it is potentially at the beginning also kind of investment, but it makes a first step towards cross-border collaboration, but also ownership, I think, is important. Yeah, maybe this is what I thought a short comment for that could be of support for discussions.
Wonderful, wonderful. Thank you so much, Monica. Teresia, can we have your thoughts on the balance of these cutting-edge technologies?
My thoughts are that yes, sometimes we may not have these cutting-edge technologies within, and sometimes we do. But we also need to develop, supportive policies that help us harness the use of these technologies. Sometimes the institution A has advantage or has access to these technologies, which institution B does not have. Is it possible to collaborate, to partner so that we are able to benefit from these technologies? And therefore, leveraging on strategic partnerships and collaborations, particularly in regard to sharing, technology transfer, knowledge sharing, and even capacity building opportunities. I also think creation of centers of excellence, for different research things, whether it is in country or within a region or even intercontinental, that because centers of excellence have the magic of concentrating expertise and also resources for specific research areas, and also enabling development of certain level, international grade, laboratories that can help in maximizing resource utilization, and also impact, the impact that we get out of that sharing and that mechanism. So it is really possible to have use of cutting edge technologies, even when we have resource constraints, but perhaps looking at leveraging on those collaborations, partnerships, also, supportive policies, and also the issue of concentrating them in terms of having centers of excellence.
Thank you so much, Teresia. I know time is not on our side, and therefore I want to bring this to a quick close. But I do have two more questions that I think are really important. Now, we've been talking about, of course, what research priorities do we want to have? How do we integrate policy? What is the role of the international consortia? We talked about sustainability. I think what is critical, and I want to bring in Maria, is about data ownership and sharing. How do we ensure that the data that is being generated through these collaborative projects is also something that remains accessible and beneficial in the real sense to the African researchers and communities over the long term?
Thank you for this question, Mohammed. I will also first of respond you that we are organizing a training event on data and implementation of research that will be at the end of the year, and we hope to open the registration in May. Just to be tenant about this, because it will be open worldwide in the framework of the European Partnership on Personal Medicine. And replying to your question, of course, always under the umbrella of the ethics, I think it requires a multifaceted approach, building an ecosystem that combines agreements, infrastructure, training, sustainability, and also community involvement. It's essential to establish a clear data sharing agreements from the start of any collaboration. And these agreements should prioritize equitable access for all the partners and specify outline how data will be used, stored, and shared over time. Secondly, we need also an important investment in infrastructure, for example, creating a supporting data repositories with African institutions that ensure that the data is stored locally and remains accessible to researchers in the region. Coupled also with training programs on data analysis, management, as Monica said before, and this empowers African researchers to fully leverage the data for new discoveries and innovation. And last, the long-term accessibility. Collaborative projects should include plans for ongoing maintenance of data repository and foster partnership with organizations that can provide resources or funding beyond the project's life cycle. We must ensure that the data generated serves the needs of local communities, but involve them in setting research priorities and translating the findings into actionable outcomes for their benefit. This is also, we have not to forget the communities in the sharing data. And this is all.
Thank you. Thank you so much, Maria. I now want to bring this Q&A session, the roundtable, to a close by my last question to Erica. Erica, I know you've been really spearheading this program, and of course, I've had multiple interactions with you. I know the passion with which you are working with the team, and I know how hard you're working to make sure that this is a success. But I really want to know from your own perspective, what would you think, or what would success look like, in your opinion, for Africa and Europe collaboration in the next 10 years? So how do you see this? What would you consider this to be a success in the next 10 years, looking at how far you've come from this project and where we want to go ahead?
Okay, now thank you, Mohammed. For me, the success really should be valued in tangible things. In this regard, I would say, like, first idea is EU-Africa PerMed was a 4-year project, and we've been successful in integrating 3 African organizations in IC PerMed so far. So there's one from South Africa, one from Egypt, and one from Tunisia. My success will be that this should not stop because EU-Africa PerMed is finished, and in 10 years there could be, I don't know, 10 organizations from Africa participating in IC PerMed, because I think it really is the way of not losing the African perspective in a forum of policymakers and funders where you are discussing about the strategic research agendas. So bringing Africa is really, really important, and these type of platforms are sustainable. And so for me, a great success that will be that more African organizations join EU-Africa IC PerMed. And also that, of course, there will be more funding. I think the funding is, it seems like we are always asking for funding, but it's the reality. I mean, if there is no especially sustained funding coming from the funders to support this, in this regard, I would love that the European Commission would continue to support activities such as the ones we have done in EU-Africa PerMed with another project, because at the end, as I was saying before, these small projects do a lot because they create networks, they create knowledge. For example, I feel very happy that Teresia in Kenya has learned about personalized medicine, and I think they are now capable on their own to advance personalized medicine in Kenya and in the East Africa region. So these type of projects, they have little impacts that can really make a change. So of course, more funding available, more opportunities for African organizations to participate in European projects. That's also something that maybe I would like to share now, is that it's any African organization can participate in European research projects. This is also really, really valuable. As we say, personalized medicine should be something that can be included in any topic that is carrying out research on health, could incorporate personalized medicine activities. So sometimes we are thinking, no, it has to be a specific program on personalized medicine. No, it can be a project working on cancer, on infectious disease, on many things, bringing the personalized medicine perspective. And for me, just a small recommendation is, I know it's very difficult to join European consortia coming from African countries, because you need to know somebody in Europe. That's the truth. I mean, it's a way of try to find African researchers that are working in Europe as a means to provide you the possibility to join consortiums in Europe and start collaborating, because European funds are open to any African organization. You can participate, but you need some links in Europe. So those are some of the ideas that come to my mind, and tangible things that I will love to see in the coming 10 years, so that this momentum that we have created in EU-Africa PerMed doesn't disappear. I'm sure it's not going to disappear, because, as I say, I mean, we have the EU-Africa PerMed community. Monica will continue in her role in EP PerMed and IC PerMed. Maria Jose as well. Teresa, I'm sure. Ridwana in South Africa. So I'm sure Mohammed also as part of the EU-Africa team. But those are my first thoughts about how would be something successful for the coming 10 years.
Absolutely. And of course, not forgetting that we really see implementation where personalized medicine impacts our patient, because in the end, whatever we're doing, it is for our patient. So I hope that is also something that will become a reality in Africa. Thank you so much. I just want to take the opportunity to thank all of you, Erica, Maria, Monica, and Teresia, for your time and brilliant answers. I hope the audience enjoyed the discussion and were able to take back home some of the key messages that were shared during the roundtable discussion. Once again, thank you very much for the opportunity given to me to moderate this discussion. It's always a pleasure to work with you. I think it's so much fun, and also there's so much that is work to be done still to do in the future. With that, I want to end the roundtable discussion and hand over back to Erica and Maria for the closing. Thank you.
Thank you. Thank you, Mohammed. I think we have a little bit less than 10 minutes, but Maria Jose, maybe we can, I've seen in the chat that some people would like to comment. Maybe we can open up now the floor if any of the participants would like to speak and make any comment or any, because I saw that some of you wanted to add to some of our responses and ideas. So maybe if anybody would like to speak and open their microphones, I think we can have this little time left for anybody who would like to make a comment. My problem is I don't see the
Yes, I don't know.
the list of participants. So I don't know if anybody wants to. Oh, here comes. Okay, perfect. Yes, I heard that Dr. Lucas Niabero wanted to add something to one of my responses. So yes, please go ahead.
Can you hear me?
Yes.
Okay, this is a very good, I've really learned a lot from this. And I have a couple of things to add. When you were talking about what the European policymakers can do, how about just making sure that any new medications that are being allowed to come into the market have pharmacogenetic information so that we can easily use it? Because a lot of those medications don't have pharmacogenetic information, so then you can't personalize at that level. On what Teresia was saying about how the governments can support this or get behind precision medicine, I think if we can come up with economic opportunity cost, if I use precision medicine to give one dose instead of 10 doses of different medications, I've just saved the healthcare system some money. And that's another way they look at it and say, this is important, yes. The other thing is, we've assumed that precision medicine is a Lamborghini of healthcare. It's actually not. So the logic of saying it's very expensive, so it's a Lamborghini, Africans maybe need just a bicycle to go from one end to another. The fact that most of the Africans are not represented in most of the medication studies trials, which is a fact, we do not quite understand how the African person is going to respond to the medication. Yes, we use scientific extrapolation, but we don't quite know. And then the other thing that comes in is the interaction of the drug and the lifestyle in Africa, from the food to our genetics to other things, which then makes precision medicine more important for the African patient than even the European patient, who's actually has been represented in the studies that are being done. Last but not least, policy. I think I put something there on the chart. There are some countries, I think the US is one of them, where before they started doing a lot of genetic work, they put in a law that suggested you cannot use the pharmacogenetic or genetic information to deny care or deny insurance. So if we do not have such a thing in Africa, of course, all the insurance companies work on risk and probability. If they can reduce the risk by looking at your genetics, they will not offer you that insurance. So I think precision medicine also has to come with the guardrails to support the systems in Africa. Because right now, if we really move very fast and get precision medicine running, I am a precision medicine expert. I love precision medicine. I think some people are going to actually really be disadvantaged for us not having the policy guidelines or the legislative support to help. Thank you very much.
Thank you very much, Dr. Lucas. I think you've brought to the table really relevant things that are also in discussion in Europe, for sure. I don't know if any of my colleagues would like to. Monica.
Yeah, just a very short point. I mean, I overall agree in the general comment, just a short point regarding the first part, which is on pharmacogenomics. I think this is an example where we see that Europe has a lot of knowledge, but is not yet also at the stage of implementation. So you have seen, maybe, I don't know if you're aware of it, it is one of the high topics considered by the EMA, the European Medical Agency, and also it is a current topic of the call for the European Partnership for Personalized Medicine. And indeed, I think it is a topic not that we understand or we need to promote that it needs to be considered, but we are really at a step where also in Europe we need to understand how we implement it. So I think here really Europe and Africa can work hand in hand, and there are a lot of ways also still to go when it comes to implementation on the European perspective. So just I wanted to mention on this specific point.
Any more comments? Okay, Portia Managazira, yes, you can comment.
Oh, thank you very much. I'm a clinician in a district in Zimbabwe, so I really appreciate the rich information shared in this segment. I think it's also going to enrich my work, but I'm also going to be looking out for opportunities where we can get a bit more capacitation in terms of clinical mentorships, decision making, but also the personalized medicine and how we can link up with local research and academics here in Zimbabwe to get more equipped. We have a lot of health challenges against a background of limited resources. So I fully agree with most of the submissions, including the last one. Thank you very much.
Thank you. Thank you very much, Dr. Portia, for sharing your thoughts. I think we are, oh, there's another one. Okay. Takunda Mukumba, you can talk.
No, thank you, Erica. I was just going to say, unfortunately I joined the meeting late. Sorry about that. But this is a very interesting conversation. And I happen to be a member of the International Pharmaceutical Federation, and I'm part of their technology advisory group, and I'm also based in Africa. So if there is a way that I can assist in any way, especially linking what you're doing with the International Pharmaceutical Federation and also bring in the African perspective, because I'm African myself, based in Zimbabwe, I would really like to assist. Unfortunately, I joined the meeting a little late because I only saw the link in my email a little late, but I really would love to be able to participate in this initiative because it's really great. And I think it can lead to great patient outcomes.
Thank you very much, Takunda. We take into account your predisposition to support, and great to link with the pharmaceutical industry because it really is a relevant stakeholder in terms of implementation of personalized medicine. So thank you very much. I think, oh, there's another one. Okay, the last one. Rispa Torrey. Yes, you can speak. Rispa? We cannot hear you. You are muted.
Oh, okay. Now I get it.
Okay, now we can hear you.
I'm very thankful for your talk. I benefited from the first summer school while we were in Cape Town. And I've worked so close with Professor Maritha, who is one of the champions of personalized medicine in South Africa. My question is, I really appreciate the fact that you are having us use the action plan for application of grants. I'm asking, I'm currently working on a grant. I don't know if I use the action plan. Should I maybe involve one of you and the other way around? How can we work close together so that people who are of the same interest, like personalized medicine in Kenya, can work so close to Teresa? Because all of us, when we work together, we are stronger because we have bits and bits of information. So that is my question. How will we collaborate with you, especially with the use of action plan in application of grants and the other way around? Thank you.
I very quickly, I think for application of grants, you can cite the action plan if you feel it helps to support what you are proposing in the submission. I mean, I'm thinking that sometimes when I'm preparing European projects, and I prepare the proposal to a topic that is launched by the Commission, it's always good that what you propose not only comes from your own thinking, but it's supported by the work of others. So in this regard, that's my idea of the action plan, that in case you want to propose a collaborative topic on an area because you think it's important for anything related to the health you are you are preparing, use the action plan. So that would be my idea. And the collaboration, I don't know if there's any possibility to create a community of practice or something. It is something we have thought, especially for sustaining the EU-Africa PerMed project further on, because it will finish in January, but it's a pity that we lose this EU-Africa PerMed networking that has been created through the webinars, and that at some moments it helped to make collaborations between researchers in South Africa and in Kenya, for example. So it could be an opportunity to create like a community of practice or some type of informal network so that people can still get in touch. I don't really know how to do this, but maybe it could be an idea. Any comments from? Okay, I think we can finish now, Maria Jose. I think we are on time now. So from my side, just to thank all the participants, all the speakers, especially Maria Jose, who is the leader of our training and capacity building activities and who has launched the webinar. And nothing more from my side. Maria Jose, if you just want to close.
Yes, thank you to all the speakers and all the participants to support our webinars, and I hope you can revise and take a look of all the activities that are recorded are somewhere in our website. And of course, we will try to follow the contact with our created African scientific community to be involved in the different other initiatives that can be open worldwide. And I hope we can be in touch in the future for other initiatives. Thank you very much. And I don't know if my other colleagues want to say something, but otherwise we close the webinar. Okay. Thank you very much and to all. Bye.
Bye-bye. Thank you very much.
Bye-bye. Thank you.